My name is Heather Rodriguez. Welcome to today's Fertility Scope. We're going to be talking about essential oils and aromatherapy. I'm a natural fertility specialist. So what that means is my team and I help couples who are preparing for conception. We focus on diet, herbs, supplements, lifestyle changes, all of that stuff to help you prepare for a healthier pregnancy. So we're going to jump into today's topic. So essential oils Essential oils, are they safe for fertility and pregnancy? It's not going to be a black and white answer of yes or no, obviously. My answers never are because it's all a big, broad spectrum. When it comes to aromatherapy and essential oils, there are thousands of different plants that can be extracted for essential oil usage. So I'm going to actually break this talk into two parts. The first is we're going to talk briefly actually about fertility and essential oil usage with that. And then we're going to talk about it with a pregnancy. So the first part is with fertility, essential oils are very beneficial. There's something that can be added to your fertility program. Specific essential oils can be beneficial for hormonal balance, libido, helping to support the overall system, and helping to deal with stress as it comes to fertility and the fertility journey. So with fertility, it's going to be a totally different kind of focus because you're not pregnant yet. There's not a fetus for us to be concerned about. But if you're actively trying to conceive, you do want to treat the second half of your cycle when implantation could possibly be occurring as if you are pregnant. So that is how fertility would actually tie into today's talk. So normally the first half of your cycle you can use essential oils. The second half of your cycle you need to start acting like you're pregnant in case there is a fertilized egg, an embryo that's implanting. We need to treat that as a pregnancy, obviously. So when it comes to essential oil usage for pregnancy, what needs to be understood is all the different things that are happening with pregnancy and how it needs to be treated differently than normal everyday life. So essential oils are such amazing compounds. I always tell my friends, the question of if you were stuck on a deserted island, what would you take with you? One of my things would be my essential oils because I just love them so much. But one of the things we need to think about when it comes to pregnancy or when you're actively trying to conceive during the second part of your cycle is that once you're pregnant, your chemistry is very different. There's a lot of hormonal changes going on. There's a lot of very complex systems and things changing and shifting and growing. So we actually don't want to alter that by using herbs or essential oils during that time. So that's something to think about, is how much is happening within the body, and we don't want to mess with that essentially. The other thing to know is that when you're pregnant, what you're putting into your body, what you're eating could possibly cross over through the placenta. So that's something that's always studied for drugs. It's studied for different supplements and herbs, is will the compounds of that herb or whatever it was that you ingested or put on your body cross the placenta barrier, because that could very well affect a developing fetus who does not have any protective mechanisms to prevent that from affecting their brain, their nervous system, etc. So we're always going to assume with essential oils that yes, they will. There has not been much studies done on essential oils and their ability to cross the placental barrier. So we're just going to assume that that is happening just to be safe. So one of the things to consider is the first trimester is always going to be the most delicate time of a pregnancy. We don't want to be using things that are going to affect the very, very critical time of the development of our child. So essential oils, I generally think that they should just be avoided during the first trimester. The only time that they might be used is maybe to help to alleviate some type of discomfort, but during first trimester, I think the safest bet is to just actually not use essential oils during that period of time. I think for pregnancy overall, essential oils should only be used for helping maybe with some nausea, with some aches and pains, things like that, but it's not something that we would actually be using as often as we use when we're not pregnant. Like my essential oil usage right now, there is no way I would use the essential oils as frequently. I'm diffusing them, I'm putting them neat on my feet, I'm using them on my skincare. I use a lot of essential oils through the day. I would definitely pull back on that amount of the essential oils I'm using. And this directly pertains only to the female. A male using essential oils, it's not going to affect her unless she is smelling the oils, which is a very effective way of using essential oils. So know that smelling them is a way that essential oils do get into the body, and then they react just the same. So another thing to think about is we want to always use a 1% dilution when you are using essential oils during pregnancy. And I'll cover what kind of oils to avoid and why, so that you understand there's actually a really, really big list. And I know there may be some people who automatically assume because essential oils are natural and essential oils are amazing that they're just safe, just period. And that's not true. They're very, very concentrated. So 1% dilution. So what that would mean, 1% dilution is going to be about 5 to 6 drops added to 1 ounce of carrier oil, such as olive oil or coconut oil or something like that. So carrier oil is going to be 1 ounce, and then you would put 5 to 6 drops. That's the kind of dilution you need to be using during pregnancy. 1% dilution. That's also the same dilution we would use for children. And it's always better to just be cautious and be safe. So there's no essential oil studies done on pregnant women. There's no studies done for herbs for pregnant women mostly, because who's going to sign up for that study, right? If something goes wrong, that's not great. So we're just gonna be very cautious. So something to consider too is the route of absorption. So there's different levels of absorption and how strong something's going to be. So if you're using internally, that's the strongest route of absorption. I would never suggest anyone use essential oils internally during pregnancy. That is definitely not a good thing to do. There's also, you would not use them orally, rectally, or vaginally. I think that's inappropriate actually in general for everybody, but for pregnancy, of course, you would not use them in that way. And then also using them on the skin in neat, high doses. So what neat means is when you're applying essential oils straight, you're just pouring the essential oils onto your skin. You're not diluting it. That is considered neat, N-E-A-T. I would definitely not suggest using oils neat while you are pregnant, because that's going to be very, very high, too strong of a usage for the essential oil. And also skin application on a daily basis over time can build up as well. So that's something to think about reducing. The next level is going to be steam inhalation. So you got like the pot of water boiling on your stove, you have the essential oils in there, and you've got the towel. That's a very strong way of using essential oils. I would not suggest that during pregnancy. Then we've got diffusion, which is one of my favorite ways, which is using a diffuser where it disperses it through the room and you're inhaling it through the day. That is a very strong way actually of inhaling essential oils, depending on what oils you're using and where you are when you're using them. So you can do that for short periods of time during pregnancy with very specific oils, but you don't want to do it throughout the day like I personally actually, do. So that's something I would pull back on and not diffuse so frequently. And I'd be very, very picky about the oil that I use. And then the other is going to be inhalation, where I don't know if you've seen those little inhalation sticks you can stick in your nose, and you can get the essential oils right into your system. That's going to be too strong as well. So I know I sound super cautious, but it's because essential oils are so concentrated that there is a concern. So it sounds like you should always be diluting oils if you're wanting and trying to get pregnant. Yes, especially, I think it's just the safe way to go. The thing I think a lot of people don't understand about essential oils is they work just as well diluted as they do neat. We don't need stronger is not better, more is not better with essential oils. They are so concentrated that diluted essential oils are just as effective. There's been studies that shown that lavender diluted actually works better for stress headaches than lavender neat. So it's not, this more is better mentality just isn't, it's not needed. You can dilute it and be very safe with them and get great effects from them. So in pregnancy, again, I would just reserve essential oil use for nausea, for calming anxiety, surrounding sleep, achy knees, things like that. I wouldn't just use it on a daily basis for enjoyment. So you need to consider dilution. We talked about 1%. Yeah, exactly. Too much can definitely, especially in the case of essential oils, there's already the amount of plant matter in 1 drop of essential oil is astounding. You have to understand just how concentrated these plants are. So the other thing to consider too is if you're going to be using essential oils during pregnancy, it would be great if you're working with an aromatherapist or a midwife that was really well-versed and educated with essential oils. That would be very helpful. But on the other hand, there are oils that are safe when used properly at 1% dilution. So I'm not trying to freak you out and make it so you think you can't ever use essential oils again. I just do want to bring awareness to it because I feel like there's a lot of people out there who are so passionate about essential oils, and I'm so excited about that, but they are teaching people that because something is safe, that we can just rub them directly on our feet, on our young children and during pregnancy. And for me, that is just not correct. And for many of you don't know, I should have probably said, I'm actually going to school right now to become a clinical aromatherapist. So that's where I'm actually learning this from, and how I'm learning more about this is something that's so close to my heart, and it pertains to the work that I currently do. So I just was like, wow, people really need to know about this, not to scare them, but to use things properly. So then there's just a couple more points. The other is to consider quality of essential oils. That's so important. Not all oils are created equal. A lot of oils are adulterized. So that means that there's things that are added to make the oil less expensive for the manufacturer, but it still smells the same, but it's not an actual medicinal quality essential oil. There's testing that can be done. I only order my essential oils from companies that do chromographing on their batches that come in. Every single batch of essential oil that I use in my products and for myself have been tested for the active compounds to make sure there's no synthetics in there. More and more companies are doing that, so I think that's really great. At no extra cost. You can see the panel and everything, but I get really geeky with this stuff. So just make sure you're getting high quality essential oils. And also, now we're going to get into the actual oils. So considering what oils are safe to use, and when you're using them during pregnancy, using them very appropriately. So when I was pulling together the notes for this talk, I thought I was going to bring a list of oils. Don't use these oils. Here's the main handful of oils not to use. And the list of oils are so long that you can't use during pregnancy that I'm going to mention some of the more popular ones that are pretty common. But I'm first going to tell you what kind of oils, like kind of the group of oils to avoid. And that's going to be, okay, let me just pull this up. Sorry. Okay, so that's going to be oils with certain type of actions. Oils that have an action on stimulating the uterus, oils that are can affect the blood. So if they're helping to thin the blood, or they're helping to create blood clotting, oils that that have that specific type of action on the body. So some of the more, and you can look this up. So where I got this information on the oils to avoid during pregnancy is going to be from Robert Tisserand's book. So Robert, and his last name is Tisserand, Tisserand, Robert Tisserand. And he's got a complete list of what oils to use and what oils to avoid. So there's a whole list here. I'm not going to read every single one of them, but some of the more popular ones. We've got anise oil. We have carrot seed. I use carrot seed in skincare. Cinnamon bark. So cinnamon is something that's found in thieves, gourd. A lot of the immune blends you're going to find cinnamon. Cinnamon is a very, very strong essential oil. Should not be used during pregnancy. Cypress. I love cypress, but should not be used during pregnancy. Fennel. Hyssop. Spanish lavender. So this is a very rare lavender. Lavandula stoenchicus, which is one I've actually never used. So lavender angustifolia and spike lavender at a 1% dilution are going to be considered safe for pregnancy. Mugwort, of course. Mugwort is a very, very strong oil. I have some that I found through a specialized supplier. It's not something that's very common that you're going to find, but mugwort is used as a, it kills worms in your body. So it's, obviously you don't want to use that during pregnancy. Super strong. And this one's kind of sad. Myrrh. Myrrh is another oil that has two different compounds in it that should be avoided during pregnancy. Oregano, which does oregano really surprise you guys? It's such a strong oil that even on an everyday basis, I actually don't really like to use it. It's so strong, but oregano should be avoided. Parsley leaf, pennyroyal, of course, I think that's one everyone's heard about. That's more of a abortifacient. A lot of these are. We've got sage, Dalmatian sage and Spanish sage. I would avoid all sage essential oil during pregnancy. Tansy, it's going to be blue tansy. What a great oil, but it should be avoided during pregnancy. Wintergreen. Yeah, it's amazing how many herbs and plants. And the thing too is that some of it is because it hasn't been tested. Some of it's just because we're being safe, and some of it is because there are actual specific actions it can have on the body that are not good for the developing fetus. So Yeah, it's amazing how much you can't do when you're pregnant. I totally hear you. We have wormwood and yarrow. That's another one. So those are definitely, those have specific compounds that should not be taken and used during pregnancy. I'm going to share a quick list of oils that should be reduced or restricted during lactation. So this is after you've had your baby. You can start beginning to use more oils, but remember that this is going into your breast milk, and your young little child is getting whatever is in your breast milk. So it's also said to avoid basil, lemon balm, lemongrass, melissa, myrtle, nasturtium absolute, which sounds great. I've never actually used that one. Tea tree, thyme, and verbena. Those are more common herbs. Tea tree is something I know people use very frequently. And Robert Tisserand, who is one of the leading essential oil chemists, one of the main people I've learned from about chemistry and essential oils, says that should be avoided during pregnancy. So what does that leave us with? So we are back to the very common simple oils. A great oil would be lavender. Lavender is good for everything. It's very affordable. It's very effective at 1% dilution. Lavender augustifolia is going to be great for immune system, for relaxing, for reducing stress. And then spike lavender is going to be more for helping with muscle soreness and inflammation. But again, we're only using this at 1% dilution, diluting that with coconut oil, whatever you like, avocado oil, jojoba, whatever you want. Another oil is lemon. Another one is orange, geranium. These used at a very low dilution will be fine when you're using them for specific reasons. Ginger is another one. That's one I used during my pregnancy because I had such severe nausea. I was trying so many different things, and ginger was one of the things that I was trying. My nausea was so severe, nothing worked for me though, unfortunately. So that's kind of the mind frame that I wanted to kind of put you guys in, to know that there is a shift that needs to happen during the last 2 weeks of your active cycle when you're actively trying to conceive, and then once you become pregnant with your essential oil usage. So just learning about that. Robert Tisserand has a fantastic book. It's called the Essential Oil Safety Book. If you guys are really into essential oils, it's a great read. If you're into, the more scientific end of things, and it's going to have the complete list there of oils to avoid. So that's something I personally have on hand for school, but for during pregnancy as well. So if you guys have any questions, did you find that helpful? I hope I didn't freak you out too much. I just think it's really important to understand, how to use essential oils safely during pregnancy, and that there does need to be a difference in how you're using them and how you're treating them. All right, guys. Well, have a great weekend. I will see you later.